Can you hear me now? All right. We're early or we're on time? Which is it?
I don't know, but so you know how we're working on our website? Went down the rabbit hole, and you know how we said there were very few renal cases? There's a
Yeah.
lot more than there are liver cases. Holy cow.
Well, that doesn't actually surprise me. You're surprised? Versus liver?
No, but thank goodness for AI to help me translate some of these, but some of these I can't access. But yeah, it's a lot. It's very interesting.
Well, if they're in JMEG, you can log in as me and get them out of JMEG. Some of the
Well,
others possibly too. Maybe some Sage journals I have full access to, but I'll give you
yeah,
my JMEG and let me know about any in Sage and I'll try to pull them for you.
yeah. A lot of them, well, some of them are like pretty old. I do
Yeah.
have one it's in Hungarian, and evidently she had both kidneys affected in not ureters, which made me question embryological, but
Oh
I
dear.
cannot access it. I went through every database. No libraries have them. Even when it converted to another journal. In that one, I'm really interested to see what was going on with it. But
Oh, send me the citation. I'll dig too, see if I can find it someplace for you.
yeah,
Hi,
that would be great. Good morning,
everybody.
everybody. Good morning. Jillian, did you get my email I sent about the Washington working group becoming active?
I did. I was only able to scan it. I will read it, but that's exciting. So is when are they starting up?
So they have started up. I was just hoping to get you kind of on board and maybe just give it's Tina Orwell. She's a Washington State senator. She is a
Okay.
licensed social worker. And so I went to the first meeting I went to was the third meeting. And so they'd already kind of got together, but we're missing some good key people. But we have a lot of people from the Department of Health. We have a lot of people who do, we have the director that does the licensing and credentialing for all medical professionals in Washington. So that one, I'm really excited about having him on board. Yeah, I was just hoping to kind of weave you into it a little bit because I kind of like was directing him into some of the good paths to go down because they hadn't quite, put together exactly the idea of where to go. And they're still in the stages of not really realizing how significant the barriers are. Not like, oh, well, let's just send out a survey to doctors. No, that's not going to work.
Yeah,
So yeah, so hopefully we can
I would be
communicate through
happy to.
emails.
Yes.
Yeah,
Okay.
thank you.
Wonderful. It's exciting.
Yes, very exciting.
I'm going to give it just a couple of minutes. I hope everyone's staying warm. It's freezing.
We have a Pineapple Express out here. We're flooding.
Oh man, it is
Yeah,
cold.
it's near 60. Went left Connecticut at 14 degrees and got to here and it was 57 and pouring down rain.
All right, why don't we jump in? Good afternoon, everyone. Welcome to the December meeting of the Endometriosis Working Group. We are on CTN today. I'm going to go around by doing introductions, like we always do. I'm Jillian Gilchrist, State Representative from West Hartford and Chair of the Endometriosis Working Group. Just going to call on your names as I see them. Wendy, go right ahead.
Hi, good morning. My name is Wendy Bingham, and I am a person with endometriosis, and I'm here representing the nonprofit Extra Pelvic Not Rare to improve awareness that the disease extends beyond the reproductive system. And I'm here to just participate and carry over some of what the good work is being done and suggestions for our new working group in Washington.
Yay.
Thank you.
Wonderful. Thank you. Heather, go right ahead.
Hi, everybody. Heather Guidone from the Center for Endometriosis Care. First, happy holidays to everybody. And second, congratulations to EndoRise on a fantastic, fantastic event. It was really good to see everybody that could come.
Wonderful. Beth?
Hi, my name is Beth Ludwig, and I am an endo mom and always learning new stuff on this group. So I really appreciate it. Thank you.
Thank you. Cassidy?
Hi, my name is Casey. I'm a clinical research assistant at UConn Health and also the clinical coordinator for EndoRise. It's good to see everyone.
Nice to see you. Sam?
Hi, thank you again, Representative Gilchrist, for inviting me. So good to see people at the EndoRise Forum. I'm so honored to deeply honored to be here. I live in Quaker Hill, Connecticut, southeastern part of Connecticut, and preeclampsia HELP syndrome survivor, stage 4 endo warrior. And I've been into biopharma for 2 decades, mostly on R&D and clinical trials, but I'm spending the second half of my career focusing on patient advocacy as I was once a patient as well. So I've been immersed in bringing in the voices of the patients and their care partners and into my company, and that's not easier said than done. So I am very happy to be here, and if I can help with anything in any way to help advocate for endometriosis and bring in the voices to anyone that wants to listen and those that don't. I know how to get that.
Great. Thank you. Carol?
It's good to see everyone. Happy holidays. I'm Carol Johnson. I'm the CEO of Uter and Kind, and we focus on awareness and education for endometriosis and the other conditions that onset in adolescence that are wildly underdiagnosed and undertreated.
Great. Thanks for being here. Jenny?
Hi, everybody. My name is Jenny Cole. I'm the Menstrual Equity Project Manager at the Diaper Bank of Connecticut, and we're also the Connecticut chapter of the Alliance, the Alliance for Period Supplies.
Great. Thanks. Iris?
Hi, my name is Iris Smith. I'm here at the Cleveland Clinic, and I was invited by way of Dr. Luciano. And this is my first meeting, so thank you so much for inviting me. And I am really just looking towards, developing our own replica of EndoRise here in Ohio. So I'm trying to get as much information as possible, learn from all of you, and hopefully we can see this come to fruition here in Ohio.
Wonderful. Yasmina?
Hello, everyone. I'm Yasmina Kulanchis, a program manager for EndoRise, and thank you all for being here today.
Thank you. Arlie?
Hi, sorry, I have a naughty cat knocking things down. I'm Arlie. I'm a patient advocate, and I am all things endo and menopause, women's health. Very happy to be here as always, and thank you to EndoRise again for that great event. And yeah, happy to be here and always looking to contribute.
Wonderful. Thank you. Dr. Luciano?
Hi, I'm Danielle Luciano. I'm a minimally invasive GYN specialist, endometriosis surgeon at UConn and co-director of the EndoRise program. Welcome.
Thanks. Brian?
Good afternoon. I'm Brian Kennard, Director of Government Relations at the Connecticut Hospital Association.
Wonderful. Michelle?
Hi, everyone. Michelle Snyder. I run the commercialization and innovation team for Aspira Women's Health. We are developing a endometriosis non-invasive blood test and are currently in the stages of very rigorous validation. And this group is tremendously helpful to help us guide this test through the development phases and really listening to how we can get this test into the hands of patients and providers.
Wonderful. Thank you. Brianne?
Hi, I am the clerk to the Human Services Committee and the aide to Representative Gilchrist.
Good to see you. Thank you for your help. Jolie?
Hi, I'm Jolie. I'm MSW student intern to Representative Jillian Gilchrist.
Good to see you. Thank you. Kaylee? Oh, okay.
Hey everyone, I'm Kaylee. I'm an endometriosis patient and advocate. Excited to see everybody.
Good to see you. Caroline?
Hi, everyone. Can you hear me?
Yes.
Yeah, sorry, I can't turn my camera on because I'm actually in lab right now. I am a postdoctoral associate at the Jackson Laboratory. I walk alongside Dr. Lise Courtois, and we study the underlying mechanisms of endometriosis.
Wonderful.
Good to be here.
Daisy?
Hi there. I'm Daisy. I'm a research assistant at the Jackson Lab, and I'm working to process patient samples as part of the Endorise biorepository.
Wonderful. And Lisa? Lisa, if you're speaking, you're on mute. Okay, maybe she can't say anything right now. All right. Next up, I'm going to do as we always do at the start of our meetings, give some space for folks if they want to share their own experience with endometriosis.
I can go. So I was diagnosed in 97, stage 3 endometriosis, and I've had multiple comorbidity diagnoses, including interstitial cystitis, Hashimoto's, multiple organ failures and removals. Yeah, it's been quite a journey. I also have MCAS, POTS. Gosh, I forget. So I'm also a researcher. So my own personal journey has really pushed me to do more research in this realm. So thank you, everyone, for all that you do.
Thank you. Thank you for sharing your experience with us.
I can go. I was diagnosed with frozen pelvis, stage 4 endometriosis in my mid-20s, experienced like terrible pain, was always pushed to like maybe wipe better or take more Advil or take more Motrin. And then was luckily, by the grace of God, I was able to have twins. I have 17-year-old twins, a boy and a girl. They're graduating from high school in a few months. And selfishly, I'm here because, I'm worried about my daughter. She hasn't shown signs and symptoms yet, but also for everyone else. And I'm still a patient. I would never be not a patient of endometriosis. So I really want to help uh, increase awareness, find a treatment, share the stories of everyone, and hopefully one day, someday, this will not be, it won't take 7 years to get diagnosed.
Thank you, Sam. Thank you. Thank you. Thank you both. It's very helpful and brings us all into the space of why we're here, right? And so we are now going to move to the next agenda item, which is a follow-up from a conversation we had a few months back about what resources are available to people here in the state and across the country with regards to endometriosis education, because oftentimes that conversation comes up, as well as it should, about the need to educate. And so I'm going to turn it over to Jolie. I'm going to share my screen because Jolie created a resource document, and she's going to talk through that process. We are not trying to step on toes. Our goal here is we will house this on the endometriosis working group website, just as a simple tool where folks can find some education resources. So I'm going to share screen, and then Jolie, feel free to jump in. Can you all see that? Okay.
So like Representative Gilchrist said, I took the information from the PowerPoint that I created and just made it into a more accessible document and provided information on all the organizations that we've discussed previously. And then for each organization, there's like a little description of what they all provide and their different toolkits or programs. So I just wanted to like talk about how for each of the organization and programs, there's a hyperlink that will bring you directly to each of the websites or toolkits or different programs that are mentioned on the document. And it was very, each website provided accessible resources and information on endometriosis and what studies that they all provide and the different toolkits for different perspective groups. And just in particular, like Endo Black, their website provided like numerous resources. Oops, it's at the end, sorry. Right over there. I don't want to talk too much because it is right there, but Endo Black, their website provided numerous resources to help with different doctor visits. There's guides on health and nutrition tips, toolkits for advocacy, and like much more. And I found it very helpful to and like very informative how they provided different documents that people could bring to different doctor's appointments, or if they just wanted to know more information or wanted to help to spread awareness on endometriosis, it was more easy to access, not more easy, but it was easy to access from this website. And they also provided different studies that people can be a part of. They did mention their video game study last meeting, which I found very interesting because it's the Sir Endo study and it's more particularly geared towards ages 13 to 25. And it's a video game that will help provide information and awareness on endometriosis for Black and Latina young women. And I found that like very informative because it will help them get into this topic on different with a different format. And then I also wanted to talk about Uterine Kind. They mentioned last meeting that they have a free accessible app that is accessible on all mobile devices. And after that meeting, I personally downloaded that app and it's very useful. It has provides full body symptom tracking. It lets users to create access printable symptom reports, and it takes your data from your tracker and creates it into a downloadable report to bring it to doctor's appointments. And they also provide other resources and information on endometriosis and other conditions. And I just found that very helpful. And I wouldn't have known about these different organizations or programs if I didn't conduct these research. And I wanted to just highlight how helpful everyone, like each of these organizations are on spreading the awareness of endometriosis.
Thank you. So in addition to putting it on the website, we will email this out to the group. And then if you have feedback, if you have questions right now for Jolie or feedback or ideas of other places we should put this, but again, wasn't meant to kind of go overboard, just in case as these conversations come up and as we're seeing today, new people join, it's good to have a resource list that we can just provide folks. So any questions or thoughts? And thank you, Jolie, so much. And thank you all. It was helpful for me too to hear feedback on how Jolie found finding the information and using the information. So appreciate it. All right, then we'll move on to the next point in the agenda. We typically have as a standing piece of our agenda an update from EndoRise, but wanted to give them a little more space because, as you've already heard, some folks were able to attend the EndoRise Fall Forum, which was last Monday. And so just wanted to give some time and space for you to update us on how that went and any information you can share.
Okay, 1 second. I'll share the screen. Are you able to see my screen?
Yes.
Okay, perfect. Like I mentioned earlier, I'm Yasmina Kulancic, the program manager for Endorise, and I'm really happy to be here to provide some updates. To start off, just want to touch upon our awareness and outreach to our community. Last month in November, I attended the Connecticut Association of School-Based Health Centers conference in Southbury. What this conference really aims to do is bring together school providers, school nurses, providers throughout the health throughout Connecticut, policymakers, to kind of get everyone together to talk about how advancing using the latest technology, the latest research that has come out to treat students and provide the best and latest care. So it's really important to, emphasizes on utilizing state resources, so such as programs like ourselves and many others throughout Connecticut, to leverage those resources to advance the care for students in healthcare, and it goes way also into like mental health, physical care of the oops, I'm sorry, I have like a little stroke. So basically just providing and advancing the school-based health center resources for students. We were there as a table sponsor for this event, so we were able to distribute Endorise pamphlets and resources that we have for school educators to be able to have them in their office for students to be able to access. We really emphasize on engaging those conversations with students because a lot of times the school nurses are the primary or the first point of contact for endometriosis patients. So this was really a great event for us to engage with our communities and put our Endorise out there and highlight the need for endometriosis treatments. And then to jump into our the Endorise Fall Forum recap. This was an event we held last Monday, December 8th. So it's been almost a week. Actually, it has been a week, which is kind of crazy. There was such a high building up to it, and then here we are. So we had a press release that Jax put out last week, really highlighting the key aspects of the forum. If you scan the QR code, it'll lead you to the actual article. This is also posted on our webpage, so you're able to read more about it if you didn't get a chance to attend. So our event was really focused on bringing the researchers, clinicians, policymakers, and patient advocates into one setting to talk about the diagnostic challenges, the challenges in patient care, the latest research that's happening from some of our keynote and speakers that we had at the event. So it was a great chance for everyone to be in the same room together, have an open conversation, and hear from some of the leading experts in endometriosis. So we also were super lucky to have WTNH, so Channel 8 News here in Connecticut, attend the event and also share some key highlights from the event on their webpage and during the on the news. So we got a lot of outreach from that, them sharing our story. We had a lot of our inbox was full from patients and advocates and caregivers throughout Connecticut reaching out to want to be more involved and to learn more about Endorise and what we do. And then the same thing here, the QR code leads you directly to the WTNH page, but this is also posted on our Endorise webpage. Just to kind of give a little recap, we had fireside chat participants. This was a panel with patient advocates, healthcare providers, researchers, which was moderated by the Connecticut public journalist, Michaela Savitt. It gave a really great chance for patient advocates to connect and have to connect with the clinicians and researchers that we actually had here, and also connect with the audience. The audience got to ask some great questions, and it was really on building that interdisciplinary care for endometriosis patients, talking about treatment for pelvic floor treatments, mental health support that's needed. So it's not just a siloed disease. There's so many different aspects that are involved in treating endometriosis patients. So that was really important for us to get across to people that were attending and that wanted to learn more about coming out and advocating for themselves, to their family members, to healthcare providers, so we had a few advocates that really share their personal journeys and the challenges they had experienced through getting a diagnosis, even post-diagnosis, and just treatment in general. So it was great to get everyone together in the same room. We also had a keynote address by Dr. Stacy Misner. She's a leading epidemiologist in the world that studies endometriosis. So she talked about challenges, innovations, and really the need for collaborations between clinicians, patient advocates, and patients themselves, as well as researchers to know to figure out the next thing and how really to get the women at the forefront so they're believed about this disease, because a lot of times, as we all know, is such a stigma, and there's a lot of gaslighting from healthcare providers that a lot of patients continuously express. So she really great talk and also presented some of her research. Unfortunately, we're not able to share the recorded session of the research presentation because it has a lot of unpublished data. But if you'd like to, I am able to share some of the slides from that are already published if anyone's interested in some of her presentation. And then we had a panel discussion post Dr. Misner's talk. This was really bringing together once again, patient advocates and clinicians together. So we had Dr. Frederick Croft from Connecticut Children's Medical Center talking about the youth challenge, the challenges that come with treating young adolescent with endometriosis. We had Heather Guidon, who's with us today, bringing the patient advocate side, and also Julia Mandeville from the Barbados Association of Endometriosis. And this panel was moderated by our co-director, Daniel Luciano. And this gave a great chance for patient advocates and the attendees as well to ask some direct questions to the clinicians about, why there's long delays in diagnostic, the challenges with, hormonal contraception for treatment of endometriosis and long-term side effects and things like that. So it was great to hear kind of both perspectives and from clinicians and patient advocates here. And this, so we do have the panel sessions recorded if anyone's interested, and they will be going up on our site very soon on our EndoRise webpage. And then panel 2 was really focused on research that's going on in endometriosis field. This is moderated by Dr. Elise Courtois, the other co-director our EndoRise. She's not able to be here with us today, but we had Dr. Katie Burns talk. She gave a great presentation on endometriosis. We also have some of that session recorded, but some of it is redacted with unpublished research. Dr. Tamer Sechkin from the EndoFound and the Lenox Hill Hospital, he's the founder of EndoFound, so the Endometriosis Foundation of America, gave us a very interesting presentation on diagnosing and looking out for lesions from the surgical perspective. So we had a lot of video from camera, from his surgical cameras that, how he's kind of excising these lesions. It's not for the weak heart of of people, but if you're interested in also sharing this, seeing some of this, the presentations from here, I'm able to share those as well at your request. Oops, sorry, I missed one really important one. Dr. Mickey Tall, she gave a great presentation on Lyme disease and gynecological conditions correlations. So it's talking about not only endometriosis, but adenomyosis, different gynecological conditions and the correlation with Lyme disease and the treatment and the prevalence of Lyme disease with women that have gynecological conditions. Just a little biorepository update. We're nearing enrollment of 100 participants into the BioRep. So thank you. So thankful for our patients that are, willing to contribute and share their tissues and biospecimens to advance research and hopefully advance endometriosis research and eventually be able to find some kind of cure or a non-invasive test for detection of endometriosis. So we have over 4,000 biospecimens banked here in the biorepository. These biospecimens are at the brink of starting distribution to researchers around the world. So whether the basic researchers or startups, biotech companies or pharma companies, that they can use these specimens to, be able to test out some of the diagnostic tools that they're working on, or understanding endometriosis on a deeper level from the biological perspective. So we had a long road behind us for legal paperwork in terms of use for of the specimens. We, thought like, oh, we're going to get these out right away, and it's a lot more complicated than we initially anticipated. So we're really happy that we're nearing the distribution, and we're aiming to start distribution of Q1 of this upcoming year. And with that, again, thank you all that support our program, and thank you for those that attended virtually or in person. And for those that couldn't make the event, please reach out if you have any questions or want more information on the event. With that, that's it. Thank you.
Wonderful. Thank you. I am so disappointed I couldn't stay for the entire event. Thank you for the recap. And I'd also say, having been in government for a while now, you guys are moving faster than most people ever move. So well done.
Well, the war group and you definitely help with that. So thank you.
Yeah, it's very impressive. Any questions, comments, or feedback from folks?
I have a question regarding the target audience for the schools. Are you starting in middle school, high school, or way before that?
So we're currently starting with the high schools. It's a little easier for us to connect with the school educators and nurses in high schools just because of the whole age thing. And in the high schools, they have a lot of schools have like lunch and learn sessions that they will kind of help get the students in, and for us to be able to go in there. In the middle school, it's a little harder, but we have connected with the school nurses directly from a couple schools throughout the state, but not with the students. So that's going to be something that we work toward in the next year or so.
Great, thank you.
Thank you. Anyone else? I am seeing in the chat, would love a copy of the slides. So Yasmina, do you just want to send those over and we can send out whatever slides people can actually have access to?
I could do that, but also if people send me their direct reach out through contact at CT Enterprise, just so that I have kind of where the slides are going, if that makes sense.
Yep. So actually, yeah, if you just want to add your contact in the chat, or that'd be great.
Thank you.
Arlie, go right ahead.
Thanks. I am just curious, and would love to talk more about how we can connect with pediatricians. I would love to get some feedback in terms of what they're seeing, if they're seeing anything in their office, if that age group, will say 16 and younger, if anyone is even really presenting with endo-like symptoms coming in. I wonder how we can loop in pediatricians more. I thought it was great that we had one on the panel for the event. But I feel like that's a space that we haven't really gone in terms of talking about other specialists or outside of GYN, because we know from lots of patients, and I've said it myself, I suffered through my childhood with symptoms. So I just was curious, what people's thoughts were on that, and if EndoRise has reached out to their PD department at all, or I know we had Dr. Howe there, but I was hoping to get a little more information from him that day based on my question. But anyways, I would just really like to see if there's a direction that we can go in to help the younger ages, because that's a long time to go before you end up at a gynecologist. And some people don't go to the gynecologist until they're sexually active or even after. So I just think we're missing a big age group of patients, and I would hate for them to wait 20 years. We heard at the event that the pediatric gynecologist in the state won't really, touch patients under, I think they said 15. And so that's just where my brain is at right now. If anybody has any other thoughts on that, but I would just love to really see if there's something that we can do for the younger age groups.
So just to clarify, so the PD gynecologist can see any age. It's that the gynecologists at UConn Health cannot admit patients under the age of 16. So it's not that I don't see patients under 16, I just can't do surgery on them because I can't admit them.
Thank you for
But the
clarifying.
pediatric gynecologist can see all ages. And there are pediatric gynecologists at Hartford and at Yale. In terms of the pediatricians, it's a little bit tough because pediatricians, unlike OBGYNs, don't necessarily have a hospital connection. There's the pediatricians that work at CCMC are not the same as the pediatricians that are out in the office. So, I mean, I think what we would need to do is somehow find a way to, like, I don't know, I know like 100 years ago there used to be like the Connecticut OBGYN Society, which actually kind of dissolved after time, and it doesn't exist anymore. I don't know if there's a Connecticut Pediatric Society. I don't know if I don't even. I have a couple friends that are pediatricians I could reach out to, but that's a great point. It's just so difficult when people are out in millions of private offices, right? Versus, unless I guess maybe we could do something like, I know Starling has a bunch of pediatric offices underneath them. Yeah, I mean, even PCPs or family med docs might be another great spot, because I know like a lot of teenagers move from pediatricians to family med docs as they get older. Like I've moved my daughter, for example, from a pediatrician to a family med doc. Actually thinking about doing the same with my teenage boys, just because, they kind of need half adult, half kid stuff. So I don't know. But if anybody knows a way, like if there is a Connecticut organization, I think that would be great to get involved in.
Okay, thanks. Yeah, I'll kind of search around and see if I can find that. I think what was sort of touched on and what we've said before is that a lot of providers feel that if someone has not started menstruating yet, that it's not endo. And so, right, they get dragged to GI or urology. So thank you for that feedback. I just would love to somehow figure out how we can not have such a long delay. So thank you.
So Brian put it in the chat, and I did too. There is the American Academy of Pediatrics Connecticut chapter. And so the website's in there, and just a quick scan on their website looks like they have monthly board meetings. And then there is an education tab that says they have webinars. So there could be the very, the potential to start with meeting with their board or someone there, and then maybe they'd allow a webinar on endometriosis, which is similar to the work being done with the nurses. So that would be awesome. At least just start to spread the word. Okay. Kaylee, go right ahead.
Hey, yeah, I just had something to add to that conversation. Coming from an awareness advocacy standpoint, I've worked over the past year with the Endometriosis Association, and WebMD launched a new women's health channel called Ignite, and we filmed like a short 5-minute documentary on endometriosis that is going to be shown at PCP's offices nationwide. I wonder if there's something similar from a pediatric standpoint.
Interesting. They probably have an annual conference.
Yeah, and it's just a clip that runs on the TV in the lobby or the waiting area, and it speaks to about this segment was for women's health, menopause, and endometriosis.
Okay, great suggestions. All right, I think I would assume these folks would be open to a conversation. So. All right. Any other questions, comments, feedback for EndoRise? Then this is a great segue into our next agenda item, which is a discussion on policy recommendations. For those who've been around for a while, this is going to be a recap, but for those who are new, this is how the legislative process works in Connecticut, although I think it's always helpful for people to hear it again. Every state is different, so this is specific to Connecticut. In the state of Connecticut, we have a long session, a legislative session, and then we have a short legislative session. And so this year we are entering into our short legislative session. It will run from February through May. That is when bills can be introduced. There are committee meetings. That's when the public can testify on the bills, and then we vote to pass them. And so one thing right out of the gate that we're going to need to work on is the EndoRise. Well, no. So one piece of EndoRise is the biorepository. We need to be specific on that. And the state gives funding for the biorepository. In Connecticut, we pass a 2-year budget. So this shorter session is the second year of that 2-year budget. We still want to ensure and protect that that money is kept there. Also, last year we ran into a little problem where the money for the biorepository falls under the entire budget for UConn Health, and we have been asked to make it a specific line item so that it is protected going forward. So we will be pushing for that. So that's one item. The other conversation I wanted to jump into, that was the segue piece, is education. So in prior conversations, Arlie has raised a new approach, which I think is very interesting and could work. So I'm going to share screen. Actually, before I share screen, I'll give the context again. In the state of Connecticut, or maybe I'll just say in a dreamland, in an ideal land, we would just pass legislation that says you need to educate K through 12, every student, about what endometriosis is. If only it were that simple and we could do a variety of topics. But over the years, I've tried for a variety of topics, and it's complicated because Connecticut is every town gets a say. That's kind of just our roots, it seems. And so what the State Department of Education will do is put out recommendations. So for example, we have comprehensive sexual health guidelines, but then every school system gets to implement those guidelines and choose the specific curriculum to implement the guidelines. So there's kind of the context within which we're working. And then you also have kind of competing interests of why is yours more important than this? And if we can't get this one passed, why not would we, but how could we get this one passed above this one? So that's kind of the context. We've also before in this group discussed requiring school nurses to get continuing education and offer them the Endo What platform because they can get continuing education credits. What we ran up against with that is that shockingly in the state of Connecticut, school nurses have to pay for their own continuing education, which is mind-blowing. And so I feel we would need to fix that first because they should not have to pay out of pocket for what is required of them to maintain their certification. And before we add more to their plate, I feel like we need to fix that piece. So supporting them in those efforts, then ideally would open the door. That's why you're hearing there's a lot of this more education and outreach to those groups instead of just mandating they do something. Okay, with all that said, what Arlie found is that what we do currently require in the state of Connecticut, and now I'm going to share. This is the American Academy. Sorry. Of course, I can't now get to the top of my thing. There we go. Here we go. We do require a prescribed course of study. Sorry that I just pulled this from our state statutes. And I won't read the whole thing, but it says, in public schools, the program of instruction offered shall include at least the following subject matters as taught by legally qualified teachers. And then it says the arts, career education. I'll jump ahead to the highlighted in yellow. So they do say you have to teach disease prevention and cancer awareness, including but not limited to age and developmentally appropriate instruction in performing self-examinations for the purposes of screening for breast cancer and testicular cancer, community and consumer health, physical, mental, and emotional health, including youth suicide prevention, substance abuse prevention, including instruction relating to opioid use and related disorders, safety, which shall include the safe use of social media, and may include the dangers of gang membership and accident prevention. Now, I was around, we more recently added performing self-examinations for the purpose of screening for breast cancer and testicular cancer. So that is a fairly more recent debate because I remember this happening. I could see the immediate pushback being, well, it says disease prevention and cancer awareness, including but not limited to. So schools can choose to teach about endometriosis should they want to. It's always important to know what your pushback's going to be. So that's what I would say, like that'll probably be the pushback. I think we have, though, I would say we should advocate, though, that we open this piece of the statute to include it. And then to the conversations we've had here, it's a more broad conversation about the disease of endometriosis versus it being quickly put in this bucket of a period only issue. I will stop there. I'm going to stop share just to see any conversation thoughts on this being a policy recommendation. And if you have questions on process, please ask. I'm in the weeds on the legislative stuff, but okay. So next steps, and Arlie, I will probably be reaching out to you. Because it's a short session, what that means in the state of Connecticut is only committees can introduce bills that don't have to do with money. So in like last year, well, we're still in this year, but in 2025, in that session, I could have introduced it myself as the state representative. I cannot. So we will need to go to the co-chairs of the education committee sooner than later to have a conversation with them to see if they will be willing to raise this bill. And I'm looking at Arlie because she happens to live in the community with the co-chair of the education committee. So that is a good thing. And so if we together go in for that meeting, that's a positive.
Is that Jennifer Leeper?
Yes, it is.
Okay. Okay.
Yes.
Okay. That's what I thought, but it wasn't 100%. Because we also have Kristen McCarthy-Vahey here in town as well. And she's public health, right?
She's public health, yes.
Okay.
Which could be, I mean, if we have so now if people are good on that, that would be an education proposal. We have in the past, we were able to pass successfully continuing education for physicians. That would be through public health. We could look into that, like expanding that this year for nurses and so not school nurses. Remember, I'll put a pin in that because that was the other issue of them having to pay, but other professions, pediatricians, that first bill we did that first year was about physicians, but not other specific types. And so we could look to see, can we try and add this year continuing education in a variety of categories through the Public Health Committee?
So when I met with the Connecticut School Nurses Association a couple months back, and we talked about the continuing education credits, they mentioned that nurses in Connecticut are not required to earn continuing education credits, except I think for like suicide prevention, which is only 2 hours every 6 years. So that's kind of an interesting thing. A lot of it to kind of obviously keep up with the newest education. But that's one thing in Connecticut, that they're not required to accrue those continuing education credits.
Okay.
What about an APRN?
APRNs do, I think they need 50 hours or something, as opposed to the 2 hours that the like a traditional nurse will need, RN.
I'm just thinking because like sometimes when you go into a doctor's office, right? Like the doctor isn't available, but you can see the APRN or you can see the PA. And quite honestly, I think sometimes there's a lot of people that prefer to see an APRN or a PA because they have a little bit more time than the 10 minutes that the doctor gets. So I mean, maybe we like loop this in or loop them into this as well.
What I can do is, I always call it's a magic office. Brian might laugh for this. So we have the Office of Legislative Research, and as a legislator, I can ask them to research anything, and they do it for me, which is magic. So I can ask them to pull all of the continuing education requirements for all medical providers in the state, and then we'd get a good sense of who's required to do what. So I will do that. Carol, go right ahead.
Thank you. Just a quick comment on someone had pointed out the delays in diagnoses, and we've been talking about like who are the right audiences that we should be interacting with to educate. And there's a paper on barriers to care for abnormal uterine bleeding. AUB includes adenomyosis, PCOS, a variety of conditions that cause abnormal uterine bleeding. And when I talk about endo, I always talk about AUB. When I talk about AUB, I always talk about endo because the symptoms are all the same. So I think that that's one of the issues that we have to tackle is the normalization of symptoms, because it can take up to 4 years or more for a person who's experiencing symptoms to get through that process of denormalizing what they're experiencing, if that's a word. So I think that important education is around what's normal and abnormal. So it's out of the gate, it's not disease specific. So that's just some commentary on how we can maybe accelerate getting the patient on a proper care path as early as possible.
Thank you. Very helpful. Okay. Arlie, yeah?
Yes, yeah, I just I'm wondering, I think we've talked about this a little bit, but I don't know if there is a standard form that each doctor's office has, or if that is left up to the provider in the office. But I would love to see somewhere on one of those forms a little question about pelvic pain, pain during your period. And I think the term pain is kind of relative because after having conversations with lots of teenagers, it takes about 20 to 30 minutes to get into a conversation with them where they understand what you're asking them when you say, do you have pain with your period? Because for many of us who have suffered, like it was just a norm. And if it was right out of the first period that you had pain and your family told you that that was just how the women in your family had their period, you're going to normalize it, right? So I think having something on these medical forms that then like would describe certain symptoms would be great, because I've asked people before, do you have pain with your period? And they say no. And then after talking more about like symptoms versus GI symptoms and bladder symptoms or whatever, then the wheels start to turn and then the layers start to come off. And then they're like, oh yeah, no, that's me. And you're like, well, that's a painful period. And also, just all the other symptoms that might correlate, but they don't connect. So my long-winded statement question is that like a standard form in each office that has to be filled out, or is that something that like we can sort of push to be included in that form?
Great question. And I would connect that because I had a note, we've talked here too about medical record systems, which in some ways I think is where the forms are populated. I could be wrong. Brian, I'd love to know your thoughts on this. Now I know it's the hospital lens. Do you mind sharing? Like what does that look like?
Yeah, I'm not 100% sure, but I believe across systems they will try to standardize both, through their medical records, obviously, that talk to one another, but also the forms themselves. I believe they try to standardize as best as they can, but there's not uniform across the whole state multi-system. There's not a standardized form. It might be common elements that are needed, demographic elements, date of birth, that kind of information that may be standardized, but not the particular, as we're talking here, a question about a condition.
Yeah, I mean, even Epic within each organization. So one of my medical students is trying to look at sexual abuse and pelvic pain, and even looking at, even though theoretically UConn has the exact same Epic system, right? Not every department asks that question as part of their intake. So even though it exists on the OBGYN one and it exists on, internal medicine, it doesn't exist on dermatology, for example. So it's so even something as simple like as I think incredibly important as domestic violence or violence in general, sexual violence, etc. It's not across the board, even within the same institution. So even if the EPIC program has that, you have to unclick or click to make that part of that standard form. So that's one of the issues, because we're finding that problem, like we're not finding this information from certain departments, and so it's hard for us to look at stuff.
Which makes me think, not to put this on you all, but as EndoRise is going out having these conversations with medical professionals, is that a piece of the conversation, or could it be of the value in adding a question to the intake, and or Epic? Because my mind's going, prior to getting elected, I was the director of health professional outreach for the Connecticut Coalition Against Domestic Violence. And I would go train health professionals to screen for intimate partner violence. And Women's Health Connecticut, which is a large OBGYN network here in the state, was committed to it, and it's on their intake. A variety of other entities do it too. They'll say, do you feel safe at home? But it was important to not only have them have the question, but to understand like why they have the question and how to ask it. Because if you ask it and then you don't know what to do with someone, it's actually can be even more painful, right? Like if it gets brought up in the space, you finally like, yay, I'm talking about this, and then no one does anything with it, that can actually be worse. So I'd be hesitant just to like, we're going to mandate this and then people are still clueless. But if you all are already going out, which you are, and educating health professionals, it'd be great if this was added on as a component as you're doing that. Wendy? Oh, you're muted.
Can't find my hand raising button. Is there a way that you can, I know with the UConn system there, is there a way that you can work with someone within a university setting to create just a pilot that you can execute within the University of Connecticut system, somebody that can operate it, you develop it, then you track it. How many across all different disciplines are actually picking somebody up whether it's like you said, dermatology or anything else. They did something similar to this at Legacy, and they did something specific for mental health. It was a 2-year program, and all the providers had that as part of their intake. They were all versed on how you ask the question and how you intake the question and what you do with that individual if they express a certain score for that. So I don't know if that's something you could do as a single question, or that every person as they come in and they meet that criteria to take a little, they 4 or 5 questions, and then you evaluate it, and whatever the point system is, then you would refer them to a specific person. So that's just something that I thought it would be a great little pilot. It might take, 2 years to get it done, but it would give you concrete information to then use and then take back as saying, can we now make this an institution versus a state level mandated thing?
In fact, that's exactly what my medical student pivoted her project to be. She was like, since I can't find all the information that I need, I'm going to pivot it to how can I make it so that these questions are asked. And one of the things she's actually thinking about is trying to put this into the online online questionnaire that the medical student that the patients have to fill out, because that might be a little bit easier because you're not asking the MA to ask the question. It's being put in by the patient herself. So that's actually how we pivoted the project, because we couldn't get the information we needed. We pivoted it in that direction. That's so funny.
If the patient's inputting it, then what's going to be the next step? Are you just collecting just their subjective information, saying, well, this is how many people there are, or is it going to go to the next step of that being recognized by provider at the intake and then saying we need to refer them? Where are you just at the objective side, like just observing, or is there like a step that she's looking at?
I don't know we'll finish all the steps in it before she graduates, but we're starting with step 1, which is just trying to figure out how to integrate it and get it answered, and give them resources. And then we're going to try to, go from there. But yeah, it's crazy that it takes this long. I don't want to interrupt. I see all these people with hands up, so I'm going to stop talking.
No, this is very helpful. Michelle, followed by Sam.
Yeah, thank you. And Dr. Luciano, you're completely right. A lot of times it has to be system driven. So most of my background has been in the field of hereditary cancer genetics. And we've become a long way, because way back when, just like you were saying, Arlie, it's like, do they even ask that question when you come in? Or is the provider, whether it's a pediatrics office or an OBGYN, or are they just saying, are you have any problems? And we just hope that the patient goes, oh yeah, I'm experiencing pelvic pain. So I think it's really, really important, 2 different things. If you do have a system or even an individual provider that says, this is really important to me, our unit needs to do a better job of identifying patients with pelvic pain in whatever capacity that is. So there's 2 different things we do. Number one, and remember, this is important too, as we start talking about our test indication, right? So number one is, does their current EMR system have this in there? So that's their fail-safe way of making sure that the medical assistant and or the person at the front can ensure that there is a box that they have to check and or describe that says this patient has been experiencing pelvic pain and for how long. Because you're right, if you don't ask that question, it's really difficult for them to say, oh yeah, I have pelvic pain. We all have pelvic pain. We're women, right? That's kind of the census, right? So there's that's the number one, is making sure that it's built into their EMR system. And a lot of times that's a really easy system update to be able to say, okay, we want to add this element into this section. The step 2 to that is also really, really important. What we're saying for the intake. So you think about when you go to a provider's office, a lot of times they're like, you are not coming into my waiting room until you fill out your new patient paperwork or your update paperwork for your annual or whatever that is. So what we're designing, and I'm actually in the process of working with an AI company right now to design something to where when the patient's filling out that work, it does include, have you been experiencing pelvic pain? And if so, for how long? So someone had asked, well, how does the doctor end up seeing that? Ideally, those medical assistants or whoever's in the office, nurses, whatever they are, when they look at that intake form, they're able to go, oh gosh, I see here that it's this. And then it's all about training on saying, hey, if you see this red flag go up, whether it's a digital intake form or just a paper intake form, they're able to take action. So there's a whole science around how to build this in. And it's something I really haven't thought about, just in terms of, do they even ask the question? You would think that they do, but maybe not always.
Very good points. Thank you. Sam?
Yes, I really wanted to add to that. That's a great it's a great point to add as a question. So I love my Yale New Haven primary care provider. She's great. She sees all of us, my husband, my two kids and myself. She knows my whole history about endometriosis. And but but she doesn't really have that much education about what's next for me. For example, am I still going to continue birth control to keep it quiet as my previous gynecologist did in California? Or for my daughter, she's 17. Nobody asks her about pelvic pain. My primary care finds it hilarious. I'm pretty anal about tracking her period since she first got it. So I have notes on my tracker on my phone. But all they ask is, are you safe at home? Are you depressed? Do you have sex, safe sex and all that? But so now I have to advocate. I'm back to advocating not just for myself, but for my daughter, because if she doesn't speak up, if they don't ask her, she's not going to say anything. But we have a history, and she saw that in my chart from UCLA, which was transferred over, and yet we just have to wait, if she has pain, or pap smears every 5 years. So yeah, very great suggestion on pushing for this question.
To share again from my experience, just Dr. Luciano, as your student is moving forward with this project, to me, this is just my take, it wasn't scientific, but one of the biggest barriers for providers not wanting to ask the question or being uncomfortable asking the question was that they didn't know what to do should there be a positive disclosure. And I see some parallels because since people have not really been educated on endometriosis, they might fear what they're supposed to do. And so I would always just say, just like you'd make a referral for anything else that falls outside your scope of practice, you would do the same. And now they have you guys, right, at EndoRise. So ideally, right, like it'd be like, no, you don't have to become an expert, but you can direct people to these resources. Okay.
I think that's the valid point. I mean, I think you made the absolute right point, and I think we we need to do that as part of reaching out to the American Academy of Pediatrics, and maybe also the American Academy of Family Medicine, and just try to, or Connecticut chapter of the family medicine docs. I think we need to give them resources so that they can ask the questions. But yeah, I mean, that's probably the biggest issue. And I'm sure you ran into that when you were trying to do the same thing with Women's Health Connecticut. It's hard if you don't have, as a provider, to ask a question when you don't have an answer for it.
Yeah. And medical providers like want to fix. That's what you're trained to do. And so it was like, but I can't fix this. And it would be like, it's okay. You're not supposed to be the one to fix this, but if you can get them to the people who can, like that's ideal. Arlie?
I think it's interesting, Sam, you just said that your general practitioner or PCP thinks it's entertaining that you're tracking your daughter's menstrual cycle. And it's also been my experience with different institutions that have specialists. Like, for instance, I had a surgery at a hospital. And when I was in the recovery, like post-op recovery, the nurse that was tending to me had no idea what endometriosis was. In fact, she made a comment and was like, there's so many of you girls. I just don't understand. And I was like, you're working in a hospital with a top endometriosis surgeon. How is it that you're taking care of me and hundreds of patients, but you don't understand what type of surgery I just had? And I don't mean like down to the specifics, but I find it interesting that like these large institutions that have fellowships or are training for endometriosis excision surgery haven't done more in the way to like provide that information. Like I would say there was I'm sure when the Da Vinci robot came out for laparoscopic surgery, right? I imagine that the entire institution or anybody that worked there got some sort of like email blast that like, ooh, we have this new research, we have this new like exciting diagnostic tool or surgical tool. I wish that those institutions would do the same in terms of excision surgery. Like, hey, just so we have this fellowship program, or we have these specialists that are, targeting endometriosis. So I guess it's just more of a statement, more of a point, but I would just love to see like UConn, not to call out UConn, but UConn and Yale and these institutions like show up for us. Like, I don't know, like be more at our events, but also just like be pulled into what is going on in women's health, regardless if you are working in women's health or not, like to just raise more awareness.
Very good point. Yes. Okay. Pivoting a little back to the broader conversation, are there any other policy recommendations people would like to see us work on this legislative session? It's December, there's still time. But any other thoughts come to mind? So what we've done in the past is we will create a policy recommendations document and then roll that out to the legislature. These are our recommendations, and then push for that during the session. So before doing that, though, I will make a draft and share it with the group to get approval. And then, like I mentioned, we'll also start to have some conversations to try and get other legislators on board. This is a great segue into the final conversation, because what we've also done is then invited folks off the virtual Zoom to come to the Legislative Office building together and do a press conference where we announce our policy recommendations. And it's another opportunity to bring awareness. And with this session being February to May, we could do a press conference towards the beginning of March, which happens to be Endometriosis Awareness Month, which again, segue into that piece of the agenda today. I make it very clear I will support, but I am not good on organizing an event. That's not my skill set. So, but would love to have the conversation on what we can do as a working group. And again, don't want to step on toes. So it would be good to know what other folks are doing. We can elevate what other groups are doing. But do we want to use this platform, the Endometriosis Working Group, the legislature, to do any types of events for Endometriosis Awareness Month? Please feel free to share your thoughts.
Hi, this is Georgie. I do know that Women's Health Advocates, there's a Endo working group in that's the national group. And they're planning to do Day on the Hill, just so you're aware, in March as well. And I know, so like whatever day you pick, I will say that there's that event, and then Endometriosis Foundation of America will have their event, and Patient Day is usually on a weekend. And then Endo Summit is usually end of March. Heather, you can speak to that. No, you can't. Okay. I think it's usually end of March. And then, so I'm just more thinking of dates, like those are things that I know. And then whatever we decide, I have a newsletter, FemPower Health, and social media. So I'm happy to like whatever it is, just share it there. That's all I have at the moment.
Okay, wonderful. Thank
Yep.
you. Arlie, go right ahead.
Thanks. Sorry to, or not sorry, but sorry for everyone to have to hear me so many times today. I have been in communication with a theater down here because there's two nursing schools in my town, Fairfield U and Sacred Heart. And Sacred Heart owns a theater right in the center of town. And so I thought it would be fantastic to have a below the belt screening there. And I have been in communication with the theater, and they're willing to give me like a nonprofit price to rent out the theater. But essentially, I would need to sell X amount of tickets to like not be out of pocket for that. But they were very interested in the screening of Below the Belt, and they said that they would invite all of the students from the new nursing school from Sacred Heart. They would obviously the students wouldn't have to pay for a ticket, but that they would, you know, put all the information out through their social media and through their school to raise awareness for the nursing school. So I don't know if anybody's interested in working on that with me, but I was hoping to do that within the first 2 weeks of March.
Wonderful. Do you want to drop your email into the chat? And then if folks are interested, they can connect. Georgie, you sharing what you shared made me think maybe we make the press conference day a little bit bigger in that we could do the press conference to announce the policy agenda, but then could do like a day on, we don't call it the Hill, but an advocacy day at the Capitol,
Yeah.
where we could have folks connect with their legislators.
Mhm.
Kaylee?
Absolutely.
Hey everyone. I'm working on a Stories of Strength event for March, and it's going to be an open mic style event, and it's going to feature patient stories. I don't have a date or a location yet, but if anyone would want to collab on that, I'll drop my email in the chat.
Wonderful. Thank you. And then, Yasmina, what are you all planning?
So I know initially we talked about doing, like, in addition to the press release, to do an event at the Capitol that's kind of open to everyone for attendance. So I think we need to kind of hash out the details in our next steps to see how we all align. But that's kind of, we were hoping to do something bigger. Yeah.
Okay, so we'll keep talking that through, but that'd be, yeah, we can do something at the Capitol like a day. Okay.
And yes, echoing what Dr. Luciano just put in the comments, any events that we can help kind of share on our webpage and social media. I typically try to do it on social media, reposting and resharing, but if you want any events listed on our webpage, just let us know.
Great. All right, wonderful. There's still time, so keep it in mind, but I think if we can all share what's going on, the more the better. Okay, any additional updates or information for the good of the order that people would like to share with the group today?
I have a question about the education of nurses. How are we reaching out to the particular schools? And is it something that, like, I could go to my local school and ask if they would like a presentation from EndoRise on that? How are we working that?
So currently it's been us, like either we get like somebody from the community that has some kind of contact with the schools. So we connected that way, and some of it has been like direct outreach, us trying to connect to the school nurses. But yes, that would be very helpful if you have resources at the school that we can connect with to do either a virtual or in-person presentation. We're more than happy to do so.
Okay. Thank you very much.
Wonderful. Thank you. Great question. Okay. Well, thank you. This was fantastic dialogue today. As I know many of you feel, I learn something every time we come together, so I really appreciate it. And like I said, next steps on my end, I will get a draft policy recommendation to be shared. But until we meet again, which will be January, we are the second Monday. We switched this month, but January 12th will be our next Zoom. So please hold that 1 to 2:30. What is JPM? Starts on that day. Oh. I still don't know what that means, Carol. Should I know what that means?
Yeah, it's
Oh, there's a health conference.
Huge. Yeah.
I'm sorry.
There just might be a lot of people traveling that day.
Okay.
Yeah. The 12th through the 15th, pretty much everyone in healthcare descends on California.
All right, let me take a look then. Maybe we'll switch that date, so stay tuned.
There might be some cool reporting back out from that if we wanted to make it for the following Monday. And I can make a note to try to capture what's going on there on the endo side.
I usually hate doing this in a group, but how would people feel about Tuesday, January 20th? The following Monday happens to be Martin Luther King Day, so we can't.
That works for me.
Tuesday, January 20th. I'm seeing, yeah.
I think that works. Works for us, our team.
All right, so that will be our next endo meeting. And until then, happy holidays, everyone. I hope you have a
happy holidays.
Happy holidays.
Holiday.